All right, good afternoon, everyone. I want to thank you for joining me this afternoon to talk about a bill that will be introduced at this evening's City Council hearing. I'd also like to thank the coordinated efforts of the Baltimore Development Corporation, Health Department, Department of Planning, which led the the Baltimore Food Policy Initiative. I want to give special thanks to our Health Commissioner, Dr. Lena Wen, BDC President and CEO Bill Cole, and Assistant Director of Planning, whose last name I'll never get right, Theo Yang. Yeah, did I get it? Yeah, you got it, right there. And our food, well, I'm equal opportunity. I don't know if Holly is ever Freistadt or Freistadt, but I want to thank our Food Policy Director as well. You would think by now I'd get it, right? So now I don't feel so bad. So in June, we released our Food Environment Map report that provides a detailed analysis of where and why food access or lack of access to food causes such serious concerns in our city. I'd like to take a minute to provide the context of why we're introducing this piece of legislation to add to the ways in which my administration has addressed food deserts and food access issues in our city. We know that 1/4 of the residents in Baltimore City live in food deserts, where accessing healthy food is an everyday struggle. Unfortunately, children are impacted even more, with nearly 1 in 3 living in a food desert. And when you look at many of our neighborhoods, there is a life expectancy disparity of 20 years, and that relates in part to our food deserts. To close these immense gaps, we must take deliberate steps to eliminate our food deserts. That's why I'm so glad that our council members have been briefed on the specific food environments in their districts, so we have great partners in this effort. Districts face different challenges across the board. Some districts have more seniors that are impacted by food deserts. Others have more children. Some districts see dramatic disparities between Black and white residents, but all of us need to know the specific concerns of our neighborhoods so we can develop specific responses to the issues that we face. We know that all of these, we have varying challenges, yet regardless of the differences, it's clear that increasing access to healthy, affordable food is important across the board in all of our districts. We know the issues now, and we're proposing policy solutions that can make a significant impact now and into the future. Food retail is a key piece to eliminate food deserts, and we know that most residents view food access in terms of whether or not they have high-quality supermarkets or grocery stores nearby. We now know that some independent grocery retailers struggle in our city, as they do in many urban environments. Supermarkets are committed to providing food access, yet they often have policy and financial barriers that make it difficult for them to be sustainable and for them to offer the types of services and amenities that they would like to offer to many of our neighborhoods. To address these barriers, the first tenet of our 5-point food desert retail strategy is to retain and to attract more supermarkets. I'm so pleased to speak with you today about two of these policies that support this goal. A personal property tax credit for supermarkets in and nearby food deserts, as well as an extension of the SNAP issuance benefit period. First, I'm very proud to introduce a personal property tax credit for qualifying supermarkets. This legislation is very narrowly focused and has one priority: attracting and retaining supermarkets in areas where they are most needed. The Food Environment Report very clearly outlines where improved food access is needed the most. The legislation designates these areas needed as of highest need as food desert retail incentive areas. This is where you would be able to apply and qualify for the personal property tax credit. This legislation is a necessary strategy in our food access efforts, and is meant to create change where it is needed the most. The credit is not for all food retailers. It is very targeted to retailers in food desert retail incentive areas and specifically for supermarkets. Not for mega stores, not for corner stores. This is for supermarket. And I want to thank the General Assembly for approving the enabling legislation in the spring that allowed us to push this tax credit forward. This bill is going before the City Council and will actually put the tax credit into effect. I'll let Bill Cole provide you with some more details momentarily, but we believe that this credit is a critical tool in attracting and retaining high-quality retailers in Baltimore's food deserts, while providing residents with the food access that they want and they need. The second policy that supports our retail strategy is the lengthening of SNAP benefit issuance period. It's a mouthful. Our retailers came to us several years ago and described the issues they face when SNAP benefits are only distributed during 10 days. And I hope you're going to speak to this from a business perspective as well, because you know the challenges that we've talked about with our retailers. These challenges include keeping a consistent stock throughout the month, hiring full-time employees, keeping full-time employers, and increasing security concerns. It also makes for a crowded and less desirable shopping experience for customers when there's such a condensed period of time in which they have to access their SNAP benefits. When so many people are shopping on the same days, it is a challenge for businesses that are trying to, as I said, keep fresh food on the shelves and keep their stores manned with employees. So after years of advocacy and encouragement from my administration, the Maryland Department of Human Resources has begun the process to extend the issuance of SNAP benefits, known as FSP in Maryland, formerly known as food stamps, from 10 days to 24 days. This is a big win for supermarkets and their customers, and we've already had retailers thank us for helping to smooth the retail cycle or extend the retail cycle. But we know that change can be hard, and this is a lot of information, so we've worked hard to make sure both the stores and the residents are aware of these changes and how they may be impacted in the short term. City agencies, retailers, community organizations, and volunteers have banded together to get the word out about the changes, to walk recipients through the rollout, and to provide information on the resources available to families who may have to wait a few more days for their benefits. I'm eager to hear back from our retailers on the positive impact this policy change will have on their ability to do business, and I hope that the residents understand that these changes will help stores provide better, more consistent access to healthy foods. While food deserts are a reality in Baltimore, the personal property tax credit bill and the SNAP policy change are strategies that will show tangible benefits to the food environment in our city. The Food Environment Report shows us where we need to go, and we're already making considerable progress on that path. Together, I know that we can continue to expand access to healthy and affordable food for all of Baltimore's families. With that, I am going to turn it over to Bill Cole, who will address the business concerns related to these the two new policies, and then he will bring up Dr. Nguyen. Bill?
Thank you. Good afternoon, everybody. I appreciate the opportunity for being here, Madam Mayor. And one of the key elements to livable, sustainable communities is food access. Grocery stores are critical for neighborhood stability. We also know that grocery stores are important because they often serve as a catalyst for increased economic activity in the community. The Baltimore Development Corporation's ongoing goal is to help attract and retain supermarkets, and the personal property tax credit bill for food desert incentive areas is part of a broader strategy aimed at addressing the food desert issue in Baltimore City. I'd like to take a quick opportunity to thank Department of Planning, Dr. Nguyen, and my team at BDC, Will Beckford, Michael Snidel, and Kristen Dawson for working very closely with all these other agencies on this incentive. The legislation provides for a personal property tax credit of 80% for 10 years. And it is our hope that this incentive will attract supermarkets to come into areas that desperately need a grocer. We also hope that this legislation will help retain existing grocery stores that are already operating in food desert areas if the operator is willing to make an investment in improving the store. That's so critically important. Let me be clear that retention of existing stores is a key part of our strategy, and we will continue to do everything in our collective power to assist those stores that are already serving our most economically challenged neighborhoods. Our overall goal, and BDC will continue to work closely with our partners in planning, in the mayor's office, in the Baltimore City Health Department, and every other agency, to eliminate food deserts and to provide access to healthy food choices to all of Baltimore's neighborhoods. Thank you, and with that, I'll turn it over to Dr. Nguyen.
Thank you very much, and good afternoon, everyone. You know, I think as I'm hearing Madam Mayor and Bill Cole speak about what we're doing here today, what really strikes me is that, first of all, that this is a collaboration, a partnership across a variety of agencies and groups and nonprofits and businesses here in our city. And also that all of us are recognizing education alone is not enough. That we also have to have financial incentives and we have to have policies in place that allow us to be a healthy city. So often as an emergency physician, I'll tell my patients, you have to eat better foods, you have to get exercise. And then they'll tell me, but how am I supposed to do that? If I live in an area where I cannot get to a grocery store without taking 2 buses, or I go to my local corner stop and all I get is a banana in this corner store, then how is that going to be promoting healthier lifestyles for our children and for our families? Our mayor mentioned, and we have our food environment map here, you see that 1 in 4 people in Baltimore City lives in a food desert. And what's striking too, we know that there are so many health disparities here in our city. But one disparity that is very striking is when you look at food, that 1 in 3 African Americans lives in a food desert, and 1 in 12 white people live in a food desert. And food access is something that makes our disparities worse. And if we are really going to make a dent in the health of our city, we have to start addressing food. And so today's announcement is a big win for Baltimore's families and is going to help us make Baltimore healthier and more just. So I'm glad to be joining with so many partners here, and also I want to give a shout out to Holly Freistadt. Now I don't know any Freistadt. Yeah. I don't know anymore. And I thought I knew at one point, but now I'm confused. But and I also want to acknowledge Laura Flynn here in the Baltimore City Health Department, who has pioneered many innovations for the city, including virtual supermarkets and healthy corner stores and other things that we continue to work with our partners on as well. So our mayor mentioned the news about the Department of Human Resources extending the number of SNAP issuance days from 10 to 24 families, and or from 10 to 24 days. And I just want to explain what that means, that under the current policy, families all receive their SNAP benefits at the same time, and then they all shop at the same time. But by spreading out the disbursement throughout the month, this policy will help support retailers and families by helping to sync budgets and keep grocery stores in the communities that are most in need of these healthy, affordable options. And as our mayor mentioned, the policy is going to be phased out over a 5-month period so that families and retailers have a chance to adjust to this as well. I just want to end by saying that food is a critical health issue. It's what we put into our bodies to keep us healthy and our children healthy. And in this day and age, nobody should have to worry about whether they can afford or can get access to a healthy meal. And so at the Baltimore City Health Department, we are very much committed to expanding food access. And again, we're grateful to our mayor for advocating for this policy change locally and nationally, and to all of our partners across the city for their leadership in this effort. Thank you.
Thank you very much. We're going to open up for questions.
So how many supermarkets do you think you need in the city?
That's a good question.
Great question.
Do we have a goal number for supermarkets?
We'll introduce Michael Sneidel, who is our West Team leader at Baltimore Development Corporation.
So we've done a lot of analysis on this, and what we do know is there's retail leakage coming from our food desert. So without putting an exact number on the amount of stores that could locate in a food desert, we know there's room for growth in these areas, and we know this is one tool of many that could lure grocers into this area.
Okay, and what impact, can someone give me an idea, I don't know how long it's been open, like a year, has that ShopRite, for example, made in their community on Liberty Heights?
Well, we do know for a fact that ShopRite is keeping people in the city, and they're not crossing the line because they've got a great grocery store there. Now that's a very large store. What we're talking about in most of these neighborhoods would not be anywhere near that size, because that's a very, how many square feet is that? 68,000 square feet. That's a big store. In most of the neighborhoods where we're talking about stores that are smaller than that, and we want people to try to stay in their neighborhood to do their grocery shopping. But the ShopRite has had a tremendous impact on that neighborhood in Howard's Park. It's been a beautiful store with a community center inside, community meeting rooms inside, so it's done exactly what we had hoped when it opened.
I can tell you, my mom is keeping it in business.
So is this idea based on what other cities are doing, or this is something completely new that we're engineering here in Baltimore?
So, Baltimore was the first city in the country to have a food policy director, and my advocacy locally and nationally on food policy issues is what's driving a lot of these innovative projects, things like the virtual supermarket, things like our expansion of the use of SNAP benefits in a farmer's market. So this is just another way that we're pushing for progress when it comes to dealing with food deserts in Baltimore and encouraging other jurisdictions around the country to take a look at it as well. We have a challenge because we're pushing against these national standards for food deserts that don't really work for cities. So we are constantly pushing to make sure that when we deal with the federal government and their national efforts to eliminate food deserts, that we're being clear that you have to have a strategy that works for cities, that understands that there's in many communities there are people without without personal transportation. They have public transportation, but without personal transportation, and that's why the impact of food deserts it impacts the health disparities, because that people lack access to fresh and healthy food, and they can get fried food or unhealthy food on every corner. And we're trying to do what I know our communities want, which is access to healthy food. And when we bring those healthy food options, whether it's to the corner stores with our partnership with some of our urban farmers, that people are availing themselves of those opportunities to become healthier and to eat better.
So in the grand scheme of this, keep in mind last year we lost Stop, Shop, and Save, and I probably asked you this before. While planning this new strategy, how did the closure of that chain affect the overall work?
The closure of that chain, that chain had been challenged for years. And it's more about these two policies working together, the fact that we understand that these small grocers operate on very, very small margins. And that means that they understand that their customers are very price sensitive, and they are very price sensitive. So we are looking for ways to enhance their ability to do business. And both of these things together, the property tax credit and the extension of the SNAP benefit issuance period, helps to do that and helps to create a more stable business model for these small grocers. Did you want to?
Yeah, some of the locations that were closed when Stop, Shop, and Save closed last year have reopened under a different brand name. But that's also why we focused on retention as well in this legislation, because we want the existing grocery stores to be able to invest in their stores, upgrade their refrigeration, upgrade the equipment, and that's where a lot of these costs come in for them. And the retention part is key. We don't want to, this isn't a game of whack-a-mole. We want a new grocery store to open up when one closes. We want to make certain that they all stay open and we add to the inventory.
So any interest so far? I mean, who are some of the grocers that you're looking at?
Well,
talking to?
We'll talk to any grocer that wants to come in, and we've had great conversations with all sorts of national, regional, and local brands that are looking at these locations and have been waiting since the legislature approved the ability for the city to take this step. They'll be waiting and watching to see this go through the city council, and we'll continue to work with them in looking at locations that fit this food desert map where they can take advantage of the tax credit. And we know for a fact that there's a number that are willing to step in.
There was some talk that Whole Foods was going to try to do something in more urban areas. Have you heard from them at all?
As I said, we've talked to just about every brand you can think of, and we'll continue to do that. Whole Foods is one that has already a great presence in Baltimore and would like to expand, and we'll continue to work with them. There are various different size models, and one of the things that I've learned from my team is that every neighborhood can't support a 60, 80, or 100,000 square foot grocery store. I remember texting the mayor a couple of weekends ago. I was in Montgomery County for a soccer tournament. I was standing on a corner, and there were 4 big box grocery stores on each corner. And we talked to them, and they say, well, we can only have one within 2 miles of another, and here you've got, in some counties, you've got every big name on each corner. I want to get to that point in Baltimore where they're comfortable, but we're not going to be able to attract 80,000 square foot grocery stores. They're going to be smaller, neighborhood-based community grocery stores, and that's exactly what would fit our void.
One more guy. looking at the map, and where some grocery stores are, like the northeast corner, you have 2 or 3 and it covers that entire quadrant. And then you have others like in West Baltimore where you have 2 or 3, but you still have some food deserts. Is this, how do you determine the radius and the area of what's a food desert and what's not?
You set me up perfectly. So there's a definition for Baltimore City, and there's 4 key parts. It's 185% of poverty line, a quarter mile from a grocery store, low healthy food availability, and let's see if I can remember, which did I not say? Vehicle.
You didn't mention.
Oh, vehicle access. Low vehicle access. I know those very well. I just couldn't remember which ones I said. So the question that you're asking, so when you look at areas that are white, it's probably because the income's higher, or they have vehicles, or healthy food availability. So all 4 of those factors must hold true to be in a food desert. And so that is where we see where the red is, and then you'll go to the line to the white, so meaning they're not meeting those factors.
And as we close, again, I want to thank my entire team, and we're not done. You know, we continue to look for innovative ways to address health disparities in our city, as well as food deserts in our city. And we understand the very tight connection between those things, and we will continue to push for progress in connecting more Baltimore's family to healthy food options and making sure that Baltimore is a healthy city overall. And I want to thank our partners in my administration, and also want to thank members of the City Council who have joined us, Councilman Pete Welch and Councilman Eric Costello, both of whom have been big supporters of our efforts to make Baltimore a healthier place. So thank you both. Thank you.
Thank you.